in reducing inflammation. A lot of people that we've talked to also talk about making your body more alkaline. Does that kind of go hand in hand with what you're talking about with an anti-cancer diet, or is there maybe a difference there?
Well, I think there's a lot of mythology and misunderstanding about alkaline and cancer. So what's true is around a tumor, it's more acidic because of the inherent physiology of tumor cells, which are not the same as healthy cells. So eating an alkaline diet doesn't make the area around the tumor more alkaline. So there's a misunderstanding about this. It is important to eat more plants in your diet, which makes you more alkaline slightly, but the actual acid-alkaline balance of the body is tightly regulated. And if you were to drink a whole bunch of baking soda, for example, you would return to a normal pH, a normal acid-alkaline balance, very quickly in terms of your whole body. So it's very misunderstood, I think.